Hi, my name is Debbie Granick. I'm a doctorally prepared psychiatric nurse practitioner and licensed clinical social worker in North Carolina, and this is Mental Health Minute, where I work with mental health providers to help them feel more confident and skilled as they improve the emotional well-being of their clients and build exceptional mental health practices. Thanks for joining. So we've all had it happen where someone comes into our office and they've been in therapy with someone else, or they've seen another psychiatric provider, and we've said, "What did you guys talk about? What did you cover?" And they say, "I don't really remember. I don't know too much what we did." We don't want that to be our patients. So in the next segment of Mental Health Minute, we're going to talk about ways to start and end a session to help your patients and your clients remember what they talked about. This is my special guest, my niece, Rachel. Rachel, I'm so glad you came in today. You took time out of your schedule. If I were to ask you, what are the two most important things that you want to talk about today, what would you say?
My summer plans and my plans for my school year.
Perfect. So the first thing I do is I get Rachel talking about what she wants to talk about. So that's one of the most important things to having our clients remember what they do discuss, is that they were part of developing that plan. Now, let's say Rachel's not really able to come up with that, but I still want to focus her on what she wants to discuss today. I might say, "I know it's hard for you to think about what you want to talk about today. If your mom or your best friend was here, what would they say you should talk about today?"
My mom would say that I should talk about how I'm going to get good grades for the year.
Excellent. So pulling Rachel a little outside of herself helps her think about how someone else might see what she should focus on, and that sets your kind of path to that goal. Another idea might be to really go directly into the fact that this is taking this person's time and money. And often I think as providers, we're afraid to do that. But if I can't get Rachel to really focus on a goal or hone in on what she wants to talk about, I might say, "We have about half an hour today together, and I know this was a big investment, both of your time and your money, to come here, and I want you to feel like you get out of it what you really need. What would you say that most is?" And she doesn't have to answer that as my guest, but I'm saying, like, it's okay to really lean into the reality of what our client's investment is in therapy. So we've asked these three different kinds of questions to get our clients focused on what they want to talk about. We've said, one, just what are your two priorities or three priorities? If that didn't work, I said, what would your best friend or your mother or a loved one say should be your priority? And if that doesn't work, I can just go right into, you took your time and money to come here today. What's going to make today the most valuable for you? So now we've talked, and it's the end of our session. And I want her to walk out of our session together really remembering what we talked about. So I'm just going to ask. It's coming to the end. You know, we've been talking together for about half an hour about your summer. What do you feel like you're walking out with most on your mind, having, putting all this together of everything we kind of talked over today? So I'm putting it on her. She has to think about this at the end. I might also say, what do you most want to think about over the course of the next week that you brought up today that you think you need to kind of flush through a little bit more? Okay? So again, I'm getting her thinking, and then I'm going to end with, based on what we talked about today with your summer, what did we touch on that you want to make sure we discuss next time? So I'm engaging her in the fact that she's coming back, and I'm really getting her thinking about what she did today. So those three questions. What did you most get out of today? What was most valuable today of the things that we discussed? What do you think we talked about that you need to kind of mull over and think about a little bit more? And what do you feel like we touched on that you would like to discuss next week? That's your Mental Health Minute about how to help our clients remember what they talk about in therapy. Thank you.